Thank you for joining us. This is Health and Wellness with Dr. Toby, your host. And we just want you to don't touch that dial. We have a great show with a great guest, Dr. Glenn Clyde Edward. We say Glenn Edward Clyde, but he's a psychiatrist, the medical director of Rehoboth Psychiatric Clinic in Ridgeland, Mississippi. And he's trained in medical school at the Carver School in the medical school in Iowa, went up to Ohio State for his residency, did undergrad at um, Alcorn State in Mississippi, married with a lovely family. Wife is a pathologist, and he has four lovely kids. In fact, I got to know him through one of his kids, who's a medical student, and I just was intrigued by this man who's a bivocational minister. He's a minister of the gospel, and he practices medicine, and he's been doing that for almost 25 years. In the pastorate, he's been in ministry almost 29, going to 30 years. And how many years have you been married? I don't know if that's
35. In
35.
fact, we just
Wow.
celebrated our 35th wedding anniversary last Sunday.
That is a milestone. So tell me a little bit about the bivocational ministry. How do you combine medicine and ministry successfully? Apart from being a father, husband, you're a pastor and a psychiatrist. I mean, somebody has to pay the bills, money has to come for the things that have to be paid for.
Sure.
Kids' school fees don't get paid with hallelujah, praise the Lord. I mean, how do you combine that?
Well, let me begin by first of all giving glory to God and thanking God for providing the resources, both financial, human resources to actually do what we've done and to complete what we've completed, achieve what we've achieved. And I would say that God's grace is sufficient at all times, in all ways, and whatever needs we have, He is able to supply. I think it's important for me to emphasize that and to sort of use that as my preamble to what I'm going to say. So once I kind of settled the issue of whether or not psychiatry and ministry was a conflict, once that was settled in my mind, at that point I began to really pour myself into learning and reading and educating myself as it relates to the history of Christianity, learning as much as I possibly could Greek and Hebrew, and and utilizing references, and it was really interesting because one of my arguments against the whole ministry thing was that I've already completed medical school, and and I'm almost done with residency,
years.
so I don't need to stop all of that and go into seminary or anything. And the Holy Spirit impressed upon me, no, but you can build a library, and you can read, and you can study, and you have people around you that you can access, and who have also studied and degreed, etc.
Wow.
So there was just a wealth of resources that were available to me, people, human resources, in addition to those the library that God allowed me to build for myself. And I accessed those individuals and was taught things, and and had opportunity to engage in deeper conversations, and so all of that sort of contributed to my learning and preparation. But I had settled in my mind that what I was really called to do was to be a teacher, and to be utilized by God under the leadership of a pastor. I didn't have pastoral ministry per se on my radar, but God saw differently. Psychiatry is, for me, seen as a tool that God utilizes to minister to a certain population of patients, and that's how I view it. And it's my responsibility to know as much about psychiatry, to know as much about the human body, the human brain, and how it works, and some of the maladies that it can suffer, and what to do based on modern human understanding
Right.
to address those needs
Mm-hmm.
in conjunction with my belief in God's faith and abilities to accomplish and to achieve
Wow.
His will.
I mean, if you look through the United States and the world in general, there are not that many ministers who have a medical background. I mean, I'm sure if you go to your National Baptist Association or,
Convention, yeah,
you
mhm,
probably won't find more than 10,
yeah.
15.
The
It's a
numbers are
it's
yeah
a it's
quite
a
low.
rarity. So
Yes.
what you're doing is so novel. And then when you now look at the number of psychiatrists, not just physicians, psychiatrists who are pastors, that number even thins out even
Yes.
more.
Yeah.
So thank God for his call upon your life. Tell me a little bit about what do you think the role of psychiatrists globally in advancing the gospel as a medical field? So if I took you to my missions to Africa, what role would you be able to help advance the gospel through? How do you see psychiatry as an arm of medicine in the last day gospel invasion to preach the gospel to the nations? How can you be a blessing to the nations through psychiatry,
Yeah.
basically?
Very interesting question. I think if I were to accompany you on one of your missions to Africa, and I'm putting that plug in,
Okay.
so, so let's make that happen at some
Okay.
point, right? Certainly, I would want to sort of survey the needs that individuals have. Uh, in regards to their psychiatric needs and their spiritual needs as well, and to sort of employ the approach of James, if you will. If an individual is hungry, then you feed them,
Right.
right? So let's address the psychiatric needs so that we can even position you mentally
Mm-hmm.
and intellectually to consider what you might receive through faith in Jesus
In Jesus
Christ.
Christ.
Yeah.
Uh-huh.
So the approach for me would be to deal with the human
Okay.
first and then the spiritual. Now we know that that's not the order per se of
Mm-hmm.
things, if you will, but in order for me to engage you, I
Right.
need to engage you as a human, a
Right.
person-to-person engagement first. Let me build a rapport with you at
Mm-hmm.
that level, and from there, hopefully, also address spiritual needs that
Spiritual needs.
you might
Right.
have.
And we go every year. We are going in July. Psychiatry is a big need in the third world. In the church in general, there's a stigmatization against mental health illness.
Absolutely.
People like to, call it demon possessed and don't let them in the church, and they did something bad and let's not talk about it. That's what we've seen, not just in Africa, even in the United States. To a lesser degree in Africa, it's so clan. They make it so it's so open. They label, they stigmatize, they shame, they shun, and almost like blame the person who has a
Absolutely.
mental health illness.
Right.
So you now have to deal with the self-esteem, and then deal with the medical maladies, the brain chemicals that are out of, all that. So there's psychology, there's psychiatry, there's spiritual, there's emotional. There's so much healing that is needed on
Absolutely.
a larger scale,
Yeah.
and I'm sure in
Right.
Clarksdale you face that as well.
Yeah. This notion of stigmatization is one that it's rampant. It's problematic in all circles, all cultures. I think deal with some aspects of it, and I think to some degree it's a bit of an indictment on the church,
Mm,
in the sense that rather than shunning, ostracizing, and literally excommunicating individuals because they have mental illness, it's almost an indictment on our
mm,
faith, in the sense that Jesus never told people with mental illness to get out of his
yeah,
face or go
right.
away,
He
right?
addressed
He
them, healed
addressed it,
them.
right? So is our lack of faith really the core issue with stigmatization, and it's more projection of if I can shift the attention onto you from myself,
Okay.
then there's little
Right.
questioning
So
that could be,
projection,
yeah,
yeah.
made regarding my faith. Because faith, if we truly exercise it, we have the power, the authority from him who has authority in heaven and in
Uh-huh.
earth to speak
To
to
those.
demons and possession and things of that sort, and to
Right.
cast out. Now, if that is what the person is dealing with, and in some cases that is the case,
That's right.
all right. But not everyone with a mental illness is dealing with a demon.
Right.
There are anatomical, physiologic reasons for individuals to express these type of symptoms or illnesses. And, I guess that sort of brings into conversation the sort of the divergence that took place, in the 19th century, where there was observation that there were individuals who had something going on inside of their skull, okay, whether it was a stroke or Alzheimer's as we know it now, or Huntington's or Pick's or mania or depression or OCD. Something's going on inside the skull, right? So you end up with sort of a divergence because physicians began to really look at brains after people died and saw that, well, an individual who had weakness on one side of the face, left side of his face, and weakness on the right side of his body, that individual and many in that with those same illnesses or same symptoms all had lesions on their brain in the same area. You've heard of Broca's areas. I know you know what I'm talking. So well, similar findings could be observed with Alzheimer's. All of these patients who have this dementing process have smaller brains. Not that they started out that way, but these brains have atrophied. Cells have died, right?
There's
Right.
plaques and all
Exactly.
that.
All of those things. So,
Histopathology.
yeah. So you could observe it anatomically. You could look at it microscopically using various stains, et cetera, et cetera. But there was also a category of illnesses where those brains were just as normal as a person who never had any symptoms, but they had depression or they were psychotic. They saw things that other people couldn't see, heard things that others couldn't hear, felt things that others could not feel. And these internal experiences were dictating how they functioned in society. Individuals had obsessive compulsive issues, phobias, fears, anxieties, panic attacks, very common issues, post-traumatic stress symptoms, etc. But their brains basically look normal. So you have this kind of divergence. You have one group that sort of followed the anatomical. We call them neurologists, right? And those individuals who decided that we will focus on these illnesses that are sort of nondescript. There's nothing that's obvious in their brains that we can put our hands on, but they have all of these behavioral and psychological manifestations. And we call those physicians psychiatrists.
The unseen part.
Yes.
Thanks for making that really clear. Yeah. And May is Mental Health Awareness Month.
Yes.
American Psychiatric Society wants us to talk a bit more about mental health. So what would you tell my viewers what would you advise them on mental health? How would you advise my audience to take care of their mental health? Is it really a problem in America? With all our wealth and trappings of power and luxury, do we really have an issue? Do we need psychiatrists? Are the hospitals busting at the seams with mental health illness, or is it something the doctors are making up to build insurance companies to make a extra money somewhere so they can buy a yacht and drive a limousine? That's what people think.
Right. Yeah.
So is this mental health illness a ruse, or is it real?
Mental health illness is real, okay? And to a degree, just living in the United States puts you at risk for mental illness. Because all those things that you just mentioned, all of that materialism, capitalism, and those belief systems typically is what people strive for. Now, not everybody can get that.
That's right.
Not everybody gets that.
Less than 1%
And then,
get
right,
that.
and many who have struggle to maintain. So as a consequence, there is an underlying anxiety that everybody is dealing with. Will I be able to just generally pay my bills every month? So there'll be light, there'll be water to drink, clothes on our backs, food in the refrigerator, or do we deal with the insecurities that many people suffer as relates to food, housing, etc. So it's real. And what we know is that 1 out of every 5 individuals in the United States will have a serious mental illness.
Serious mental health.
Yeah, at some point in their lives. And by serious, I mean there's clinical evidence that that individual is functioning at a much lower level than what is normal for them at over whatever time frame they may suffer. So that's 1 in 5. Every 5 people, somebody's got something going on.
And
Yeah.
I mean, it stares us in the face, but a lot of people choose to label it as, oh, he's weak, or she can't handle the heat, or they just can't, stomach some struggles. But it is mental health illness. It's not just a weakness.
Right.
It is like diabetes, hypertension.
Absolutely.
It's an illness
Right.
that has to be addressed with a professional who's a psychiatrist.
Yes.
And I think that's where people have mixed it up. If your sugar is 500, you run to the emergency room. Oh, take care of me. But if somebody's crying and sad and losing their mind, people are like, oh, get over it, behave yourself.
Yeah.
You
Yeah.
know, and
Yeah.
it's,
And that's a part of that stigmatization, I think to some degree because of just a lack of understanding, but also even related to its origins that I mentioned earlier. The word psychiatry is sort of made up of 2 Greek words, psych or psyche, depending on how you choose to pronounce it. That has to do with the mind, the spirit. It's an immaterial. It's invisible, right? And it speaks almost to sort of another world of our existence. So it's the study of this immaterial mind of the individual, and iatry is basically medicine, or one who studies and applies medicine to treat these illnesses
And that's Latin?
of the mind.
is that Latin?
Greek.
Greek. It's Greek.
Yeah.
Oh, wow.
Yeah.
I never knew that.
Yeah. So, so this notion of the mind, which has always been sort of this area where there is little understanding, right? And unfortunately, that has led to psychiatry having a rather tumultuous course to get to where we are today. Because it was the mind, so, you had people just coming up with whatever. I think this will work, or I think that'll work, or let's do this, or let's do that. So we, have gone from insulin comas to lobotomies to medications, right? And our medications are much more better and more effective because now we are applying the biological aspects, physiologic reasons
Right.
why these things are happening to
Tell us a bit
individuals.
about how you got into psychiatry. You can start from high school, maybe college. I don't know when your interest picked up in the mind, the study of the mind.
Yeah.
Because I'm sure some of my viewers are looking at you and they're like, I want to be a psychiatrist. I want to be like Dr. Glenn. So tell them a little bit of your journey,
Sure.
and then maybe they can get some inspiration for their journey.
I think probably my family and friends who grew up with me would probably say that I've just kind of always been a person of thought, and one who maybe seemed a little more mature for their age, my mindset in many cases was just maybe a little different from my peers. I thought about things on deeper levels, I guess
Mm-hmm.
you could say. Now, I had no connection with psychiatry as a kid. It's just that was, that's my personality construct. I enjoy being alone and involved in my own thoughts and where those ultimately will take me. So I think that's sort of the foundation of who I am as a person. Um, it was around the, I don't know, seventh, eighth, ninth grade that my brother Howard, the one who started a generation of physicians and psychologists and dentists and other professionals in our family, um, he said to me once, I'm also a musician. I played drums, started doing that
Wow.
just out of nowhere when I was about 4 years old. Okay, and he saw that talent, did everything he could to nurture that.
Wow.
So by the time I'm in eighth, ninth grade, I'm a pretty good drummer. Darn, pretty good at what I do. Read. It's not just hearing, but read. And able to express what's in me and bring that
Wow.
out in musical instruments, fool around with guitar, things of that sort. Um, and he made this statement to me once I was sharing with him that the band director had given us this really lengthy piece, and the drum part was quite involved. Played snare, among other percussion instruments, and
In
and
Clarksdale, in
in
Cleveland.
Cleveland, Mississippi.
Wow,
Yeah,
that was impressive.
and so this is my freshman year in high school,
Hmm.
and he says to me, well, I told him that I had memorized it, I had it down, and he said, if you can memorize that, you can memorize anything,
Oh wow.
and you can start setting your sights on things much higher than what you have been.
Wow.
I was thinking I'll just be a musician, right?
Okay.
He said, well, why not be a physician?
With a musician
Yeah,
hobby.
yes. So that started me thinking
Thinking.
in a
Wow.
totally different way. I went to decided I would go to Alcorn, and my initial thought was optometry. He's a dentist. I didn't want to do dentist, but I had been exposed to an optometrist because I wore glasses,
Oh.
right? so I went with that in mind. Actually, did quite well at Alcorn, and that's not because I came from the top of my class from high school. I was right in the middle, but that statement made
Wow.
all the
You
difference in
can
the
you
world for
can
me.
you can do
So when I
anything.
graduated from Alcorn, I
Wow.
graduated at the top of my class.
Oh wow.
Yeah, was even honored as the most outstanding senior, as they called it, or something along those lines. Got a little money, a
Oh
plaque
wow.
and that kind of thing. But as I was going through Alcorn, I decided that what, I think I want to step this up a little bit.
Mm.
I'm gonna go for the physician.
What did you study in Alcorn? Biology.
Biology
Okay.
pre-medicine.
Okay.
Yeah, I was in the band. That's how I
Ah.
paid my way
Wow.
through college. So unlike many people, I didn't have any loans when I graduated from college. I was debt free.
Wow.
Okay, but yeah. So
We don't know the band of Alcorn like we know the band of Jackson State, but there is a band in Alcorn.
uh, yes,
I mean, we
there
don't
is.
know the sonic boom of the South, but we don't know.
You don't know the sounds of dynamite.
Never
Well,
heard
you
of
need to
it.
ask
Okay.
somebody. Okay. Yeah, you need to ask somebody about that. But yeah, each summer I attended summer health science program. So the summer after my freshman year, I went to the student educational enrichment program at Augusta, Georgia, at the Medical College of Georgia. I did that again after my junior year as well. After my sophomore year, I went to the Harvard Health Professions program.
Wow.
And that was kind of a unique experience because my brother Howard had attended that program many years
Oh,
prior.
wow.
But each year, just sort of building and reinforcing and trying to expose myself to everything that I could to assure that there would be some success at the medical school level. But then, finishing up at Alcorn, got accepted to the University of Iowa.
Oh, wow.
Iowa didn't interview. All you
Yeah.
had to do was just send a good application to them.
Oh,
So, you know, I did what I needed to do. I did interview at several other places, got a few other acceptances, but one of my older professors who back in the 20s, according to him,
Iowa.
went to Iowa, got a degree in botany, and he said, well, Iowa is where you need to go. They're the
Wow.
first ones that accepted you. That's who wanted you. So that's where you. So that's how I ended up at Iowa. Met my wife.
Wow.
She was a freshman medical student as well, and we bonded pretty early on.
Wow.
She graduated from Prairie View, another SWAC
Mhm.
school, and you know, we've been together ever since.
So why psychiatry out of Harvard Medical School?
Yeah, so
could have been anything.
initially I wanted to do internal medicine and cardiology. One of our family friends, Alkanite, frat brother from Cleveland, Mississippi, very successful cardiologist in Memphis, Tennessee. I did a little shadowing with him. So that was what I wanted to do initially. And it was not until the third year that we rotated on psychiatry. My wife and I did the rotation together. She hated it, and I mean, every minute of it was just excitement to me, right? We set a record. We admitted more people one weekend than any other medical school class had, but I just loved it, right? And I said, this is just what I want to do. So initially it was just feeling at home.
Wow.
It was just feeling like this is the place to be. This is what I should do. And then I began to do a little bit of research in regards to African American psychiatrists, not many, okay, and also the history
Of
of
psychiatry.
African Americans as it
Well,
relates to
We're going to
psychiatry.
come back. Hold that thought, Dr. Glenn. We're going to come back and continue this conversation and talk a little bit more about modern day psychiatry. You don't want to miss it. God bless you. Jesus is Lord. Amen.